Best NCLEX-RN practice questions for passing the exam. Question 1. A client's wife is concerned over his behavior in recent months. He has been diagnosed with Parkinson's disease, and she is telling his nurse that he has been doing strange things. The nurse reassures the wife that the following behavior is normal with Parkinson's disease. Here are the options. Option A. Your husband will experience some periods of muscle flaccidity. Be sure to make him sit down during these periods. Option B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. Option C. Twitching of the muscles is to be expected and can occur at any time during the day. Option D. Parkinson's disease causes severe pain in the joints. You should give your husband Tylenol at those times. The correct answer is option B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. Clients with Parkinson's disease generally experience stiffness and rigid movement. B-pill rolling movements are a symptom experienced by the Parkinson client. C. Twitching of the muscles is not an expected symptom of Parkinson's disease. D. Parkinson's disease does not cause joint pain. Mild muscular pain may be present. Question 2. A male client tells his nurse that he has had an ulcer in the past and is afraid it is flaring up again. The nurse begins to ask him specific questions about his symptoms. The nurse knows that a symptom that might indicate a serious complication of an ulcer is. Here are the options. Option A. Pain in the middle of the night. Option B. A bowel movement every 35 days. Option C. Melena. Option D. Episodes of nausea and vomiting. The correct answer is option C. Melena. Clients with ulcers generally experience abdominal pain. It is common to have pain in the early morning hours with an ulcer. B. Constipation is not a symptom associated with ulcers and would indicate a need to look at other factors. C. Melena is blood in the stools. This could indicate a slow bleeding ulcer, which could result in significant amounts of blood loss over time. D. Nausea and vomiting may be present as a result of the ulcer, especially if it is a gastric ulcer. This does not indicate an immediate life-threatening complication. Question 3. A client has chronic obstructive pulmonary disease. She is slowly losing weight, and her daughter is very concerned about increasing her nutrition. The nurse helps the daughter devise a plan of care for her mother. The plan of care should include which of the following interventions to promote nutrition? Here are the options. Option A. Offer her oral hygiene before and after meals. Option B. Encourage her to consume milk products. Option C. Encourage her to engage in an activity before a meal to stimulate her appetite. Option D. Restrict her fluid intake to 3 glasses of water a day. The correct answer is option A. Offer her oral hygiene before and after meals. Clients with respiratory diseases are generally mouth breathers. Cleaning the oral cavity may improve the client's appetite, increase her feelings of well-being, and remove the taste and odor of sputum. B. Milk causes thick sputum. Therefore, milk products would not be beneficial for this client. C. Exercise prior to a meal would require increased O2 consumption and most likely would decrease the client's ability to eat. D. Clients with respiratory diseases need increased fluid to liquefy secretions. Question 4. A female client is concerned that she is in a high-risk group for the development of acquired immunodeficiency syndrome (AIDS). She wants to know about the advisability of donating blood. Which of the following responses is correct? Here are the options. Option A. Individuals who donate blood are at risk of getting the AIDS virus. You should not donate. Option B. It's okay for you to donate because the blood bank has a test that is 100% effective. Option C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. Option D. It is not a good idea for you to donate. If you have AIDS, the information is made public and could destroy your personal life. The correct answer is option C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. The AIDS virus cannot be transmitted to the donor through the blood donation procedure. B. The test for the AIDS virus is not absolutely foolproof. Therefore, it is not wise for a person with known risk factors to donate blood. C. It takes time for antibodies to the AIDS virus to develop. An infected individual could donate contaminated blood without it testing positive for the virus. D. For reasons of confidentiality, information about individuals infected with AIDS is not made public. Question 5. A 50-year-old male client is to receive chemotherapy. The physician's orders include antiemetics. When planning his care, the nurse should take into consideration that antiemetics are best administered in the following way. Here are the options. Option A. Give antiemetics when nausea is experienced and continue on a regular schedule for 1,224 hours. Option B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. Option C. Give antiemetics one at a time because combinations of antiemetics cause overwhelming side effects. Option D. Give antiemetics intermittently during the entire course of chemotherapy. The correct answer is option B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. Nausea is more difficult to control if antiemetics are withheld until nausea is experienced. B. Antiemetics should be given prophylactically at the beginning of chemotherapy and continued on an around-the-clock basis to prevent nausea. C. Combinations of antiemetics give the best control for nausea by blocking various causes of nausea induced by chemotherapy. D. Antiemetics should be given around the clock during the course of chemotherapy. This prevents nausea from developing and prevents anticipatory nausea during subsequent chemotherapy administrations. Question 6. A 30-year-old female client is receiving antineoplastic chemotherapy. Which of the following symptoms should especially concern the nurse when caring for her? Here are the options. Option A. Respiratory rate of 16 breaths/min. Option B. Pulse rate of 80 bpm. Option C. Complaints of muscle aches. Option D. A sore throat. The correct answer is option D. A sore throat. A respiratory rate of 16 breaths/min is normal and is not a cause for alarm. B. A pulse rate of 80 bpm is normal and is not a cause for alarm. C. Complaints of muscle aches are unrelated to her receiving chemotherapy. There may be other causes related to her hospital stay or the disease process. D. A sore throat is an indication of a possible infection. A client receiving chemotherapy is at risk of neutropenia. An infection in the presence of neutropenia can result in a life-threatening situation. Question 7. 7 days ago, a 45-year-old female client had an ileostomy. She is self-sufficient and well otherwise. Which of the following long-term objectives would be unrealistic? Here are the options. Option A. She should be able to control evacuation of her bowels. Option B. She should be able to return to a regular diet. Option C. She should be able to resume sexual activity. Option D. She should be able to manage her own care. The correct answer is option A. She should be able to control evacuation of her bowels. Because of the location of an ileostomy, the client will not be able to control the evacuation of her bowels. The ileostomy will drain liquid stool continuously. B. The client should be able to return to a normal, well-balanced diet. She should avoid foods that cause diarrhea or excessive gas production, and she should eat small meals. C. The client should be able to resume sexual activity. She will be able to wear a pouch. D. The client has no other health or mental problems and should be able to manage her own ileostomy. Question 8. A 26-year-old client has no children. She has had an abdominal hysterectomy. In the first 24 hours postoperatively, the nurse would be concerned if the client, here are the options. Option A. Cries easily and says she is having abdominal pain. Option B. Develops a temperature of 102 F. Option C. Has no bowel sounds. Option D. Has a urine output of 200 ml for 4 hours. The correct answer is option B. Develops a temperature of 102 F. The client may be more tearful than normal due to the stress of the surgery and its implications for her future life. She would be expected to have pain following surgery. B. A temperature of 102 F indicates an infectious process. This is not a normal sequence to surgery and indicates a need for further assessment. C. The client is expected to have no bowel sounds for 24 to 48 hours after surgery because of the trauma to the bowel. D. Normal urine output is 30 ml/hr. This represents an output of 50 ml/hr, which is greater than normal. Question 9. A 44-year-old female client is receiving external radiation to her scapula for metastases of breast cancer. Teaching related to skin care for the client would include which of the following? Here are the options. Option A. Teach her to completely clean the skin to remove all ointments and markings after each treatment. Option B. Teach her to cover broken skin in the treated area with a medicated ointment. Option C. Encourage her to wear a tight-fitting vest to support her scapula. Option D. Encourage her to avoid direct sunlight on the area being treated. The correct answer is option D. Encourage her to avoid direct sunlight on the area being treated. The skin in a treatment area should be rinsed with water and patted dry. Markings should be left intact, and the skin should not be scrubbed. B. Clients should avoid putting any creams or lotions on the treated area. This could interfere with treatment. C. Radiation therapy clients should wear loose-fitting clothes and avoid tight, irritating fabrics. D. The area of skin being treated is sensitive to sunlight, and the client should take care to prevent sun damage by avoiding direct sunlight and covering the area when she is in the sun. Question 10. A male client is being treated in the burn unit for third-degree burns on his head, neck, and upper chest received in the last 24 hours. The nurse is evaluating the effectiveness of fluid resuscitation. Which of the following indicates effective fluid balance? Here are the options. Option A. His weight increases from 165 to 175 lb. Option B. His urine output is equal to his total fluid intake. Option C. His urine output has been 35 ml/hr for the past 12 hours. Option D. His blood pressure is 94/62. The correct answer is option C. His urine output has been 35 ml/hr for the past 12 hours. A weight gain of 10 lb represents a state of overhydration. B. He is losing fluids through insensible losses. A urine output equal to his intake indicates that he is receiving too little fluids. C. A urine output greater than his intake indicates that he is receiving adequate fluid resuscitation to account for urinary and insensible losses. D. A blood pressure of 94/62 indicates a state of underhydration and inadequate circulatory volume. Question 11. A 24-year-old male client is admitted with a diagnosis of sickle cell anemia. The nurse discusses his disease with him and emphasizes the following information. Here are the options. Option A. He should monitor his sputum, stools, and urine for signs of bleeding. Option B. His daily diet should include a large amount of fluid. Option C. He should not be concerned about having to fly on a commuter airplane on a weekly basis. Option D. He should not worry about having children because this disease is passed on only by female carriers. The correct answer is option B. His daily diet should include a large amount of fluid. A bleeding is not a symptom of sickle cell anemia or sickle cell crisis. B. Decreased blood viscosity leads to sickling of red blood cells. Increased fluid intake maintains adequate circulating blood volume and decreases the chance of sickling. C. Hypoxia leads to sickling of cells. Flying in non-pressurized planes places the client in a situation of low O2 tension, which can lead to sickling. D. Male and female clients with sickle cell disease can pass the trait on to their offspring. Therefore, this client should receive genetic counseling prior to having children. Question 12. A female client has been diagnosed with chronic renal failure. She is a candidate for either peritoneal dialysis or hemodialysis and must make a choice between the two. Which information should the nurse give her to help her decide? Here are the options. Option A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. Option B. Hemodialysis involves more time to filter the blood than does peritoneal dialysis. Option C. Peritoneal dialysis has almost no complications and is less time-consuming than hemodialysis. Therefore, it is preferred. Option D. Peritoneal dialysis requires that a home health nurse prepare and administer the treatments. The correct answer is option A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. A hemodialysis is faster in clearing the blood of toxins than peritoneal dialysis. However, clients must consider the time that they spend traveling to the dialysis center and the disruption in their daily lives. The peritoneal dialysis requires several exchanges with dwelling time for the dialysate and therefore takes longer than hemodialysis. See several serious complications of peritoneal dialysis include peritonitis, catheter displacement and slash or plugging, or pain during dialysis. A client can be taught to self-administer peritoneal dialysis without the aid of a professional. Question 13. A female client decides on hemodialysis. She has an internal vascular access device placed. To ensure patency of the device, the nurse must. Here are the options. Option A. Assess the site for leakage of blood or fluids. Option B. Auscultate the site for bruit. Option C. Assess the site for bruising or hematoma. Option D. Inspect the site for color, warmth, and sensation. The correct answer is option B. Auscultate the site for bruit. This is an internal device. Assessment of the site should include assessing for swelling, pain, warmth, and discoloration. This measure does not assess patency. B. The presence of a bruit indicates good blood flow through the device. C. The nurse should inspect the site for bruising or hematoma. However, this measure does not assure patency of the device. D. The nurse should inspect the vascular access site frequently for signs of infection. However, this does not assure patency. Question 14. A client is receiving peritoneal dialysis. He has been taught to warm the dialyzing fluid prior to instilling it because. Here are the options. Option A. Warm solution helps keep the body temperature maintained within a normal range during installation. Option B. Warm solution helps dilate the peritoneal blood vessels. Option C. Warmed solution decreases the risk of peritoneal infection. Option D. Warmed solution promotes a relaxed abdominal muscle. The correct answer is option B. Warm solution helps dilate the peritoneal blood vessels. Instilling a cool solution does not significantly lower the body temperature during peritoneal dialysis. B. Warm solution does help dilate the peritoneal blood vessels, facilitating the exchange of fluids. C. Warming the dialysate does not decrease the risk of peritoneal infection. Sterile technique decreases this risk. D. Relaxing the abdominal muscles does not facilitate peritoneal dialysis. Question 15. A female client is exhibiting signs of respiratory distress. Which of the following signs indicate a possible pneumothorax? Here are the options. Option A. Crackles or rales on the affected side. Option B. Bradypnea and bradycardia. Option C. Shortness of breath and sharp pain on the affected side. Option D. Increased breath sounds on the affected side. The correct answer is option C. Shortness of breath and sharp pain on the affected side. With a pneumothorax, air occupies the pleural space. Crackles or rales are heard with increased fluid or secretions and would not be present with air in the space. B. With a pneumothorax, the client would experience tachypnea and tachycardia to compensate for the decrease in oxygenation. C. Symptoms of pneumothorax include shortness of breath, sharp pain on the affected side with movement or coughing, asymmetrical chest expansion, and diminished or absent breath sounds on the affected side. D. With a pneumothorax, breath sounds would be decreased on the affected side indicates air in the pleural space. Question 16. A female client has a chest tube placed. It is accidentally pulled out of the interpleural space when she is ambulating. The first action the nurse should take is to. Here are the options. Option A. Instruct the client to cough deeply to re-expand her lung. Option B. Put on sterile gloves and replace the tube. Option C. Apply a petrolatum dressing over the site. Option D. Auscultate the lung to determine if she needs the tube replaced. The correct answer is option C. Apply a petrolatum dressing over the site. This action is inappropriate. Coughing will not re-expand the lung and could result in further harm. B. This action is a medical procedure, not a nursing procedure. C. An occlusive dressing will prevent further air leak until the physician institutes further treatment. D. The decision to reinsert the tube is a medical decision, not a nursing one. Question 17. A male client has heart failure. He has been instructed to gradually increase his activities. Which signs and symptoms of worsening heart failure should the nurse tell him to watch for that would indicate a need for him to lower his activity level? Here are the options. Option A. Pain in his legs when he walks. Option B. Thirst, weight loss, and polyuria. Option C. Drowsiness and lethargy after his activities. Option D. Weight gain, edema in his lower extremities, and shortness of breath. The correct answer is option D. Weight gain, edema in his lower extremities, and shortness of breath. A pain in the legs could be indicative of doing too much too quickly, but not of worsening heart failure. The client should be cautioned to increase his activities slowly. B. Thirst, weight loss, and frequent urination are not indicative of heart failure. The client should report these symptoms to his physician. C. Drowsiness and lethargy are not indicative of worsening heart failure. The client should report these symptoms to his physician. D. All of these symptoms indicate a worsening cardiac condition possibly associated with too much activity. The client's activity level should be evaluated. Question 18. A male client is undergoing cardiac tests. He has been instructed to wear a Holter monitor. The nurse knows she has included the appropriate information in her teaching when the client tells her, "Here are the options." Option A. He should remove the electrodes for bathing. Option B. Damage to his heart muscle will be recorded by the monitor. Option C. He is to keep a record of everything he does during the day. Option D. He is to refrain from activities that cause chest pain. The correct answer is option C. He is to keep a record of everything he does during the day. The client should leave the electrodes in place during the entire time the test is ordered. He should not even remove the electrodes for bathing. B. The Holter monitor will record cardiac electrical activity, but will not record damage to his myocardium. C. The client should keep a record of all of his activities so the physician can correlate the ECG findings with his activities. D. The client should continue doing his regular activities. The purpose of the Holter monitor is to record heart activity during routine activities. Question 19. To prevent thrombophlebitis in a client on complete bed rest, the nursing care plan should include, here are the options. Option A. Dangle the client's legs over the edge of the bed every shift. Option B. Massage the client's calves briskly every shift. Option C. Keep the client's legs extended and discourage any movement. Option D. Have the client tighten and relax leg muscles several times daily. The correct answer is option D. Have the client tighten and relax leg muscles several times daily. Dangling the client's legs over the edge of the bed will contribute to stasis and pooling of blood and increases the risk of thrombus formation. B. Massaging the client's calves could result in dislodging an embolus. C. Decreased movement will contribute to pooling of blood and increased risk of venous thrombosis. D. Tightening and relaxing leg muscles increases circulation and decreases the risk of venous thrombosis. Question 20. A 78-year-old female client has a total hip arthroplasty. Her nurse should know that which of the following is contraindicated. Here are the options. Option A. Encourage exercises in the unaffected extremities. Option B. Encourage her to cross and uncross her legs. Option C. Check neurological and circulatory status of the affected leg hourly. Option D. Place a trochanter roll along the upper thigh of the affected leg. The correct answer is option B. Encourage her to cross and uncross her legs. Exercising the unaffected extremities will prevent contractures and emboli. B. Crossing and uncrossing the affected leg after surgery can dislocate the joint. C. Neurological and circulatory status of the affected leg has been compromised by surgery. Hourly checks are needed to monitor the status of the leg. D. A trochanter roll will prevent the upper thigh from rolling outward, increasing the chances of dislocation. Question 21. A male client has a history of diverticulosis. He has questions about the foods that he should eat. His nurse gives him the following information. Here are the options. Option A. He should be on a high-fiber diet. Option B. He should eat a low-residue diet. Option C. He should drink minimal amounts of fluids. Option D. He does not need to make any modifications. The correct answer is option A. He should be on a high-fiber diet. A client with diverticulosis should maintain a high-fiber diet and prevent constipation with bran or bulk laxatives. B. Low-residue diets lead to constipation and are contraindicated in clients with diverticulosis. C. Clients with diverticulosis should drink at least 8 glasses of water each day to prevent constipation. D. Clients with diverticulosis should modify their diet to include high-fiber foods and bulk laxatives. Question 22. A term neonate has experienced no distress at birth and has an UPGAR score of 9. Her mother has asked to breastfeed her following delivery. Immediately after birth, the neonate was most susceptible to heat loss. The most appropriate intervention to conserve heat loss and promote bonding is to. Here are the options. Option A. Place her under the radiant warmer. Option B. Dry her with blankets. Option C. Place her to her mother's breast. Option D. Place her on a heated pad. The correct answer is option C. Place her to her mother's breast. A radiant warmer maintains an optimal thermal environment by use of a thermal skin sensor taped to the infant. The warmer limits parental attachment, so, although appropriate, it is not an intervention that promotes infant attachment. B. Warmed blankets prevent heat loss in the neonate by conduction. In addition, tactile stimuli promote crying and lung expansion. This intervention does not promote attachment, however. C. Skin-to-skin contact is an effective way to conserve heat after delivery and promotes parental attachment following birth in the healthy-term infant. The first period of reactivity lasts approximately 30 minutes following birth. A strong sucking reflex and an active, awake newborn characterize this period. D. Surfaces of objects warmer than the infant promote overheating by conduction, and neonatal hyperthermia may result. Question 23. A client who is gravida 1 para 1 vaginally delivered a 7 lb girl. She received a midline episiotomy at delivery. When assessing the level of her uterus immediately following delivery, the nurse would expect the fundus to be located. Here are the options. Option A. At the umbilicus. Option B. At the symphysis pubis. Option C. Midway between the umbilicus and the xiphoid process. Option D. Midway between the umbilicus and the symphysis pubis. The correct answer is option D. Midway between the umbilicus and the symphysis pubis. Within 12 hours of delivery, the fundus of the uterus rises to, or slightly above or below, the umbilicus. Fundal height generally decreases 1 finger breadth or 1 cm/day. B. The uterus descends into the pelvic cavity at approximately 1012 postpartal days and can no longer be palpated abdominally. C. Within 12 hours of delivery, the fundus of the uterus rises to, or slightly above or below, the umbilicus. Fundal height generally decreases 1 finger breadth or 1 cm/day. An enlarged uterus may indicate subinvolution or postpartum hemorrhage. D. Immediately following delivery, the uterus lies midline, about midway between the umbilicus and the symphysis pubis. Question 24. A 9-year-old prima gravida is admitted to the labor and delivery suite of the hospital. Her husband is accompanying her. The couple tells the nurse that this is the first hospital admission for her. The client's vaginal exam indicates she is 3 cm dilated, 80% effaced, and at 0 station. Based on the vaginal exam she is in, here are the options. Option A. Stage 2 latent phase. Option B. Stage 1 active phase. Option C. Stage 3 transition phase. Option D. Stage 1 latent phase. The correct answer is option D. Stage 1 latent phase. The second stage of labor is from full cervical dilation through birth of the baby. The 3 phases of this stage include latency or resting, descent, and final transition. The client is less than fully dilated, so she is not in stage 2. B. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 cm dilated. The 3 phases of this stage include the early or latent phase or 3 cm, the active phase 47 cm, and the transitional phase 710 cm. The client is 4 cm dilated, so she is in the latent phase of the first stage of labor. C. The third stage of labor is from the birth of the baby until the delivery of the placenta. The client is less than fully dilated. D. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 cm dilated. The 3 phases of this stage include the early or latent phase 3 cm, the active phase 47 cm, and the transitional phase 710 cm. The client is 4 cm dilated, so she is in the latent phase of the first stage of labor. Question 25. A client is pregnant for the 4th time and has had 3 normal vaginal deliveries. She is in active labor and fully dilated. Suddenly she calls, "Nurse, the baby is coming." As the nurse responds to her call, which one of the following observations should the nurse make first? Here are the options. Option A. Inspect the perineum. Option B. Time the contractions. Option C. Prepare a sterile area for delivery. Option D. Auscultate for fetal heart rate FHR. The correct answer is option A. Inspect the perineum. The nurse must assess the labor status to determine if birth is imminent. The nurse may note perineal bulging, crowning, or birth of the head to ascertain labor status. B. Assessing uterine contractions is one intervention to ascertain labor status. Based on the client's cry, it is not the intervention of choice. C. If delivery of the infant is imminent, preparing a clean or sterile area for delivery is appropriate, but labor status must be established, whether delivery is imminent, by perineal assessment. D. Assessing FHR is one intervention to ascertain fetal well-being. Based on the client's cry, this is not the intervention of choice. Question 26. A client has just received an epidural block. She is laboring on her right side. The nurse notes that her blood pressure has dropped from 132/68 to 78/42 mmHg. The nurse's first action would be to, here are the options. Option A. Call the physician immediately and give dopamine IM. Option B. Turn her on her left side and recheck her blood pressure in 5 minutes. Option C. Administer oxytocin pitocin immediately and increase the rate of Roman 4 fluids. Option D. Increase the rate of Roman 4 fluids and start O2 by mask. The correct answer is option D. Increase the rate of Roman IV fluids and start O2 by mask. On nursing measures to support fetal oxygenation and promote maternal blood pressure would precede calling the physician. B. Systolic pressures below 100 mmHg or a reduction in the systolic pressure of 30% necessitate treatment. Assessing the blood pressure in 5 minutes may allow for further fetal and/or maternal compromise. Turning the client on her left side will promote utero-placental perfusion and is appropriate. C. Oxytocin-pitocin increases the strength of uterine contractions and may cause maternal hypotension. Thus, it is an inappropriate drug for use in this clinical situation. Roman IV fluids would be increased to expand the circulating blood volume and promote increased blood pressure. D. Turning the mother to her left lateral side promotes utero-placental perfusion. Roman IV fluids are administered to increase the circulating blood volume, and O2 is administered to promote fetal oxygenation and decrease the nausea accompanying the hypotension. Question 27. A 28-year-old client comes to the clinic for her first prenatal examination. In relating her obstetrical history, she tells the nurse that she has been pregnant twice before. She had a miscarriage with the first pregnancy after 6 weeks. With the second pregnancy, she delivered twin girls at 31 weeks gestation. One of the twins was stillborn and the other twin died at 4 days of age. Using a 5-digit system, the nurse records her as being. Here are the options. Option A, 2-0-2-1-0. Option B, 2-2-2-1-2. Option C, 3-0-1-1-0. Option D, 2-1-1-0-0. The correct answer is option C, 3-0-1-1-0. The first digit represents the total number of pregnancies. This client has been pregnant 3 times including this pregnancy. The twin pregnancy counts as only one pregnancy, and because she delivered prior to 37 weeks gestation, the third digit is recorded as 1. B. The first digit represents the total number of pregnancies. This client has been pregnant 3 times including this pregnancy. The second digit represents the total number of full-term deliveries. She has lost 2 pregnancies before 37 weeks gestation. At present, she has no living children, so the 5th digit is noted as 0. C. The client is pregnant for the 3rd time, and the first digit reflects the total number of pregnancies. She has had no full-term deliveries because she delivered prior to 37 gestational weeks, so the second digit is recorded as 0. The third digit represents the number of preterm deliveries, and a twin pregnancy counts as only 1 delivery. She lost an earlier pregnancy prior to 20 gestational weeks, and the 4th digit reflects spontaneous or elective abortions. Lastly, the 5th digit indicates the number of children currently living, and she has no living children. D. She is pregnant for the 3rd time, and the first digit reflects the total number of pregnancies. In the previous 2 pregnancies, she delivered prior to 37 gestational weeks, thus having no full-term deliveries, which is indicated by the 2nd digit. The 4th digit represents the total number of abortions, spontaneous or elective, and she reported a spontaneous abortion with her first pregnancy. Question 28. A 22-year-old client is 16 weeks pregnant. She and her husband are expecting their first baby. The client tells the nurse that her last normal menstrual period was February 16, with 3 days of spotting on February 17, 18, and 19. The nurse calculates her expected date of delivery to be. Here are the options. Option A, November 23rd. Option B, December 26th. Option C, September 14th. Option D, December 9th. The correct answer is option A. November 23rd. A nails rule is as follows. Add 7 days to the first day of the last menstrual period, subtract 3 months, and then add 1 year. B. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. C. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring in the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. D. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. Topic 6. Question Set F. Question 29. On the third postpartum day, a client complains of extremely tender breasts. On palpation, the nurse notes a very firm, shiny appearance to the breasts and some milk leakage. She is bottle feeding. The nurse should initially recommend to her to. Here are the options. Option A. Take 2 ibuprofen Motrin tablets by mouth now because the baby will be returning for feeding in 20 minutes. Option B. Allow the infant to breastfeed at the next feeding time to empty the breasts. Option C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. Option D. Take a warm shower and express milk from both breasts until empty. The correct answer is option C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. A judicious use of analgesics is appropriate with breast engorgement. However, mechanical suppression would be the initial recommendation. B. Breastfeeding every 11/23 hours will reduce and/or prevent breast engorgement. Breastfeeding will promote milk production, which will compound the distension and stasis of the venous circulation of engorgement in a bottle-feeding mother. C. Ice packs reduce milk flow while the snug, supportive bra provides mechanical suppression and decreases pulling on Cooper's ligament. In addition, breast binders or ACE bandages may be used for some women. D. Warmth promotes milk production and may stimulate the letdown reflex. These measures would contribute to the venous congestion of engorgement. Question 30. A registered nurse is trying to determine the appropriate care that she should provide for her obstetrical clients. Which of the following documents is considered the legal standard of practice? Here are the options. Option A. State Nursing Practice Act. Option B. AHON Standards for the Nursing Care of Women and Newborns. Option C. American Nurses Association Standards of Maternal Child Health Nursing. Option D. International Council of Nurses Code. The correct answer is option A. State Nursing Practice Act. The State Nursing Practice Act determines the standard of care for the professional nurse. B. AHON standards are published as recommendations and guidelines for maternal newborn nursing. C. American Nurses Association standards are published as recommendations and guidelines for maternal child health nursing. D. The International Council of Nurses Code emphasizes the nurse's obligations to the client rather than to the physician. It is published as recommendations and guidelines by the International Organization for Professional Nursing. Question 31. A female client admitted to the labor and delivery unit thinks her bag of water broke approximately 2 hours ago. She is having mild contractions 5 minutes apart. The most immediate nursing intervention would be to. Here are the options. Option A. Note the color and amount of fluid on her clothes. Option B. Assess the FHR. Option C. Notify the physician. Option D. Place the nitrazine test paper at the cervical OS and note the color change. The correct answer is option B. Assess the FHR. A amniotic fluid is generally pale and straw-colored. Meconium-stained amniotic fluid would indicate a previous hypoxic episode. This intervention, though appropriate, is not the immediate priority. B. With rupture of the membranes, the umbilical cord may prolapse if the presenting part does not fill the pelvis. Assessing FHR ascertains fetal well-being. See more information regarding fetal status and assessing for membrane rupture is needed prior to contacting the physician. Denitrazine test paper differentiates amniotic fluid from urine. Amniotic fluid is normally alkaline in contrast to urine, which is acidic. This intervention, though appropriate, is not the immediate priority. Question 32. A new mother experiences strong uterine contractions while breastfeeding her baby. She excitedly rings for the nurse. When the nurse arrives, the mother tells her something is wrong. This is like my labor. Which reply by the nurse identifies the physiological response of the client? Here are the options. Option A. Your breasts are secreting a hormone that enters your bloodstream and causes your abdominal muscles to contract. Option B. Prolactin increases the blood supply to your uterus, and you're feeling the effects of this blood vessel engorgement. Option C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. Option D. There is probably a small blood clot or placental fragment in your uterus, and your uterus is contracting to expel it. The correct answer is option C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. A mammary growth as well as milk production and maintenance in the breast occur in response to hormones produced primarily by the hypothalamus and the pituitary gland. B-prolactin stimulates the alveolar cells of the breast to produce milk. It is important in the initiation of breastfeeding. C. Oxytocin, which is released by the posterior pituitary, stimulates the letdown reflex by contraction of the myoepithelial cells surrounding the alveoli. In addition, it causes contractions of the uterus and uterine involution. D. After pains may occur with retained placental fragments. A boggy uterus and continued bleeding are other symptoms that occur in response to retained placental fragments. Question 33. A 20-year-old female client delivers a stillborn infant. Following the delivery, an appropriate response by the labor nurse to the question, "Why did this happen to my baby?" is, here are the options. Option A. It's God's will. It was probably for the best. There was something probably wrong with your baby. Option B. You're young. You can have other children later. Option C. I know your other children will be a great comfort to you. Option D. I can see you're upset. Would you like to see and hold your baby? The correct answer is option D. I can see you're upset. Would you like to see and hold your baby? The mother and the father require support. The nurse should not minimize their grief in this situation. B. Attachment to this infant occurs during the pregnancy for both the mother and father. Another child cannot replace this child. C. Attachment to this infant occurs during the pregnancy for both the mother and father. Siblings will not replace their feelings or minimize their loss of this infant. D. Holding and viewing the infant decreases denial and may facilitate the grief process. The nurse should prepare family members for how the infant appears she is bruised and provide support. Question 34. A client's prenatal screening indicated that she has no immunity to rubella. She is now 10 weeks pregnant. The best time to immunize her is, here are the options. Option A, in the immediate postpartum period. Option B, after the first trimester. Option C, at 28 weeks gestation. Option D, within 72 hours postpartum. The correct answer is option A, in the immediate postpartum period. The rubella vaccine is made with attenuated virus and is given in the immediate postpartum period to prevent infection during pregnancy and subsequent adverse fetal and neonatal sequelae. Mothers are advised to prevent pregnancy for 3 months following immunization. B. Rubella infection during the second trimester may result in permanent hearing loss for the fetus. C. Rogam is the drug generally administered at 28 weeks gestation to Rh-negative women. It is contraindicated to administer rubella vaccine during pregnancy. D. Rogam is the drug administered within 72 hours postpartum to Rh-negative women to prevent the development of antibodies to fetal cells. Question 35. A 24-year-old woman who is gravida 1 reports, "I can't take iron pills because they make me sick." She continues, "My bowels aren't moving either." In counseling her based on these complaints, the nurse's most appropriate response would be, "It would be beneficial for you to eat. Here are the options. Option A, prunes. Option B, green leafy vegetables. Option C, red meat. Option D, eggs. The correct answer is option A, prunes. Prunes provide fiber to decrease constipation and are an excellent source of dietary iron. As the prenatal client is not taking her supplemental iron and iron deficiency anemia is common during pregnancy. B. Green leafy vegetables provide a source of fiber and iron. However, prunes are a better source of both. C. Red meat is a good iron source, but will not address the constipation problem. D. Eggs are a good iron source, but do not address the constipation problem. Question 36. A 26-year-old female client presents at 10 weeks gestation. She currently is a G31-0-1-1. Her mother and grandmother have heart disease. Her grandmother also has insulin-dependent diabetes. The client's previous delivery was a term female infant weighing 9 lb 13 Oz. The client is 5 ft 6 inches tall and her current weight is 130 lb. Based on her history, she is at risk for developing diabetes in pregnancy. Which of the following factors places her at risk for gestational diabetes? Here are the options. Option A, age 25 years. Option B, maternal weight. Option C, previous birth of an infant weighing 9 lb. Option D, family history of heart disease. The correct answer is option C, previous birth of an infant weighing 9 lb. A maternal age older than 30 years is an identified risk factor for diabetes. Age younger than 30 years is insignificant for diabetes unless there is a familial history of diabetes. B. The client's weight is appropriate for her height. Obesity or pregnancy weight 20% of the ideal weight is a contributing factor to the development of gestational diabetes. C. The birth of an infant weighing 9 lb 4000 g is an identified risk factor for gestational diabetes. D. A familial history of heart disease is insignificant in the development of diabetes. However, a familial history of type Roman II diabetes mellitus is identified as a risk factor in the development of diabetes during pregnancy. Question 37. The nurse assesses a client's monitor strip and finds the following. uterine contractions every 3-4 minutes, lasting 6-70 seconds. FHR baseline 134,146 BPM, with accelerations to 158 BPM with fetal movement. Which nursing intervention is appropriate? Here are the options. Option A. Notify physician of non-reassuring FHR pattern. Option B. Turn the client to her left side. Option C. Start Roman 4 for fetal distress and administer O2 at 68 liters by mask. Option D. Evaluate to see if the monitor strip is reassuring. The correct answer is option D. Evaluate to see if the monitor strip is reassuring. These indices are within normal parameters. Therefore, the nurse does not need to contact the physician. B. The purpose of turning a client to her left side is to maximize uteroplacental blood flow. Based on the above assessment, there is no indication that blood flow is compromised. C. These interventions are appropriate nursing interventions for late and prolonged decelerations. Following these interventions, the nurse should notify the physician. These indices are within normal parameters. Therefore, the nurse does not need to start an Roman 4 and administer O2. D. Variations of 20 BPM above or below the baseline FHR is considered normal. Normal FHRs range from 1 to 160 BPM. As the fetus moves, the FHR increases and accelerations often occur in concert with contractions. During the active phase of labor, the frequency of uterine contractions is every 24 minutes, with an appropriate duration of 60 sec. Question 38. Early in her 9th month of pregnancy, a client has been diagnosed as having mild preeclampsia. In counseling her about her diet, the nurse must emphasize the importance of, here are the options. Option A. Decreasing her sodium intake. Option B. Decreasing her fluids. Option C. Increasing her carbohydrate intake. Option D. Eating a moderate to high protein diet. The correct answer is option D. Eating a moderate to high protein diet. Women with pregnancy-induced hypertension have a reduced plasma volume secondary to venous vessel constriction, not hypovolemia. Therefore, sodium restriction is not recommended. It is suggested that these women avoid extremely salty foods. B. Drinking 6 to 8 glasses of water per day facilitates optimal fluid volume and renal perfusion, but it will not decrease the venous vessel constriction of pregnancy-induced hypertension. C. Carbohydrate needs increase during pregnancy, specifically during the 2nd and 3rd trimesters, but they have not been linked to pregnancy-induced hypertension. D. Loss of urinary protein. Proteinuria is associated with increased permeability of the large protein molecules with pregnancy-induced hypertension. Additional dietary protein also helps increase the plasma colloidal osmotic pressure. Diets deficient in protein have been linked to pregnancy-induced hypertension. Question 39. A 30-year-old client in the 3rd trimester of her pregnancy asks the nurse for advice about upper respiratory discomforts. She complains of nasal stuffiness and epistaxis, most noticeable on the left side. Which reply by the nurse is correct? Here are the options. Option A. It sounds as though you are coming down with a bad cold. I'll ask the doctor to prescribe a decongestant for relief of symptoms. Option B. A good vaporizer will help. Avoid the cool air kind. Also, try saline nose drops and spend less time on your left side. Option C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. Option D. This is most unusual. I'm sure your obstetrician will want you to see an ENT ear, nose, Throat specialist. The correct answer is option C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. A decongestants may exaggerate the nasal stuffiness associated with pregnancy. Judicious use of decongestants and nasal sprays is advocated during pregnancy. B. Cool air vaporizers and saline drops may help to relieve the nasal stuffiness. Positioning on either lateral side does not decrease nasal stuffiness or prevent epistaxis. C. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation, which contributes to epistaxis. The nurse may recommend cool air vaporizers and saline drops to help with the nasal stuffiness. D. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation discomforts associated with pregnancy. Question 40. A newborn girl's father expresses concern that the newborn does not have good control of her hands and arms. It is important for the father to realize certain neurological patterns that characterize the newborn. Here are the options. Option A. Mild hypotonia is expected in the upper extremities. Option B. Purposeless, uncoordinated movements of the arms are indicative of neurological dysfunction. Option C. Function progresses in a head-to-toe, proximal distal fashion. Option D. Asymmetrical movement of the extremities is not unusual and will disappear with maturation of the central nervous system. The correct answer is option C. Function progresses in a head-to-toe, proximal distal fashion. A term neonates are predominantly in a flexed position with strong active muscle tone that increases. Newborns are slightly hypertonic. B. Neonatal movements may be jerky and uncoordinated as the neonate works against gravity in contrast to the buoyancy of the amniotic fluid. Jerky movements must be differentiated from the tremors of hypoglycemia, hypocalcemia, and neurological dysfunction. C. Growth of the newborn progresses in a cephalocaudal, proximal distal fashion. Knowledge regarding infant development may facilitate parental involvement and infant stimulation. D. Asymmetrical movements of the extremities are indicative of neurological dysfunction. Question 41. A client delivered a term infant 1 hour ago. Her uterus on assessment is boggy and is U+1 in contrast to the previous assessment of U2. The immediate nursing response is 2. Here are the options. Option A. Administer Methergin IM. Option B. Remove the retained placental fragments. Option C. Assist the client to the bathroom and provide cues to stimulate urination. Option D. Massage the fundus until firm. The correct answer is option D. Massage the fundus until firm. A Methergin is given following placental delivery to promote uterine contractions and prevent hemorrhage. Methergin may be administered in this clinical situation, but fundal massage would be the first response. B. Removal of retained placental fragments is done by the physician and is not the first response. C. If the fundus rises and is deviated, particularly to thyrite, the nurse should suspect bladder distension secondary to bladder and urethral trauma associated with birth and decreased bladder tone following delivery. Therefore, women have a diminished sensation to void. D. A boggy fundus rises and is indicative of blood pooling, predisposing the woman to clot formation. Massage the uterus until firm. Too vigorous massage will result in atonia. Clots may be expelled by a kneading motion of the uterus by the nurse. Question 42. A 35-year-old primigravida comes to the clinic for her first prenatal visit. The midwife, on examining the client, suspects that she is approximately 11 weeks pregnant. The pregnancy is positively confirmed by finding, here are the options. Option A, Chadwick's sign. Option B, FHR by ultrasound. Option C, enlargement of the uterus. Option D, breast tenderness and enlargement. The correct answer is option B, FHR by ultrasound. A Chadwick's sign is a presumptive sign of pregnancy. The coloration may not subside from past pregnancy or could be caused by other situations that create vasocongestion. BFHR movement observed on ultrasound is a positive diagnosis of pregnancy. C. Enlargement of the uterus may be due to fibroids or infection. It is considered a probable sign. D. Breast tenderness and enlargement is a presumptive sign because it may be due to other conditions such as premenstrual changes. Question 43. A female client has been treated since childhood for mitral valve prolapse. The antibiotic of choice for her during pregnancy would be, here are the options. Option A, sulfa. Option B, tetracycline. Option C, hydralazine. Option D, erythromycin. The correct answer is option D, erythromycin. A sulfa is a teratogen and will cause kernicterus. B. Tetracycline is a teratogen and will affect tooth development. C. Hydralazine is not an antibiotic, but a calcium channel blocker. D. Erythromycin is safe during pregnancy and can be used when the client is allergic to penicillin. Question 44. A pregnant client complains of varicosities in the third trimester. Which of the following activities should she be advised to avoid? Here are the options. Option A, sitting with legs crossed at ankles. Option B, wearing thromboembolic disease TED stockings. Option C, wearing support pantyhose. Option D, wearing knee-high stockings. The correct answer is option D, wearing knee-high stockings. A sitting with the legs crossed at the ankles does not interfere with circulation or create pressure points. BTED stockings will help to reduce the varicosity by supporting the vein. Stockings must be applied with legs elevated. C. Support pantyhose help to reduce the varicosity by supporting the vein. They also provide support to the uterus and allow for better return circulation. Hose must be applied like TED stockings. D. Knee-high stockings create constriction and pressure points that interfere with circulation in the lower extremities. Question 45. A client at 9 weeks gestation comes for an initial prenatal visit. On assessment, the nurse discovers this is her second pregnancy. Her first pregnancy resulted in a spontaneous abortion. She is 28 years old, in good health, and works full-time as an elementary school teacher. This information alerts the nurse to which of the following. Here are the options. Option A, an increased risk in maternal adaptation to pregnancy. Option B, the need for anticipatory guidance regarding the pregnancy. Option C, the need for teaching regarding family planning. Option D, an increased risk for subsequent abortions. The correct answer is option B, the need for anticipatory guidance regarding the pregnancy. A. D. There are no data to support this. B. Anticipatory guidance and health maintenance is a first-line defense in the promotion of healthy mothers and healthy babies. C. There are no data to support this at this time. This will be a concern later. Question 46. A client is pleased about being pregnant, yet states it is really not the best time, but I guess it will be okay. The nurse's assessment of this response is: here are the options. Option A. Initial maternal-infant bonding may be poor. Option B. Client may have a poor relationship with her husband. Option C. This response is normal in the first trimester. Option D. This response is abnormal to be reevaluated at the next visit. The correct answer is option C. This response is normal in the first trimester. Ambivalence is normal during the first trimester. Rivera-Rubin addresses the issue of not now in the first trimester. The statement still leaves room for exploration. B. There are no data to support this. This statement by the mother still leaves room for exploration. C. Ambivalency is normal during the first trimester. Rivera-Rubin addresses the issue of not now. This fact should be shared with the mother during further exploration of the comment. D. It is not abnormal. If it were, another month would also be too long to wait. Question 47. A client at 6 months gestation complains of tiredness and dizziness. Her hemoglobin level is 10 g/dl and her hematocrit value is 32%. Her nutritional intake is assessed as sufficient. The most likely diagnosis is: here are the options. Option A. Iron deficiency anemia. Option B. Physiological anemia. Option C. Fatigue due to stress. Option D. No problem indicated. The correct answer is option A. Iron deficiency anemia. This clinical situation is indicative of iron deficiency anemia because the client has inadequate nutritional intake. Her blood volume is increasing faster than her red blood cell volume. Anemia is present in the second trimester when the hemoglobin level is 10.5 and the hematocrit value falls below 35%. She needs increased iron supplements with follow-up. B. The client's values are below levels for physiological anemia. C. The client is fatigued because of a low hemoglobin level. D. Her hemoglobin level is low and will probably decrease even more when the blood volume peaks at 28 weeks. Question 48. In counseling a client, the nurse emphasizes the danger signals during pregnancy. On the next visit, the client identifies which of the following is a danger signal that should be reported immediately. Here are the options. Option A. Backache. Option B. Leaking of clear yellow fluid from breasts. Option C. Constipation with hemorrhoids. Option D. Visual changes. The correct answer is option D. Visual changes. A backache is a common complaint during pregnancy. Proper body mechanics, pelvic rock, back rubs, and other comfort measures should relieve the discomfort. In the presence of uterine contractions, the backache would radiate to the lower abdomen. B. Colostrum is normal and can be present anytime in the second half of pregnancy. C. Constipation and hemorrhoids are common and do need attention, but they do not constitute a dangerous situation. D. Visual changes are possibly related to PIH. The client should be assessed immediately to rule out or prevent worsening of PIH. Question 49. The client will be more comfortable and the results more accurate when the nurse prepares the client for Leopold's maneuvers by having her. Here are the options. Option A. Empty her bladder. Option B. Lie on her left side. Option C. Place her arms over her head. Option D. Force fluids 1 hour prior to procedure. The correct answer is option A. Empty her bladder. A full bladder would cause discomfort and possible urinary incontinence during the exam. B. The left side lying position would not accommodate the exam. The head of the exam table or bed can be slightly elevated to prevent supine hypotension. C. Arms extended over the head would cause the abdomen to be tighter and less easily palpable. D. Forcing fluids would encourage a full bladder, which is not desired for the exam. Question 50. Before giving metherin postpartum, the nurse should assess the client for. Here are the options. Option A. Decreased amount of lochial flow. Option B. Elevated blood pressure. Option C. Flushing. Option D. Afterpains. The correct answer is option B. Elevated blood pressure. A metherin is given to contract the uterus and to control postpartal hemorrhage. Therefore, lochial flow should decrease. B. Metherin may elevate the blood pressure. A client with an elevated blood pressure should not receive metherin, but she could be given oxytocin if necessary. C. Flushing is not a side effect of metherin. D. Afterpains are increased with metherin usage. The client should be informed that this is a normal response. Question 51. A 24 hours postpartum client complains of discomfort at the episiotomy site. On assessment, the nurse notes the episiotomy is without signs of infection. To relieve the discomfort, the nurse should first. Here are the options. Option A. Assist her with a sitz bath. Option B. Administer the prescribed medication for pain. Option C. Teach her Kegel exercises. Option D. Apply an ice pack. The correct answer is option A. Assist her with a sitz bath. A warm, moist heat will promote circulation and provide comfort. A sitz bath should be tried before medication is given. The pain medication can be given when other comfort measures such as a sitz bath and topical applications are ineffective. C. Kegel exercises facilitate sitting by decreasing tension on the episiotomy. They will not be effective for pain control or sustained comfort level. D. Ice packs are appropriate to apply in the first 12 hours post-delivery to produce vasoconstriction and to reduce edema to the area. Question 52. The nurse explains perineal hygiene self-care postpartum to the client. She should be instructed to. Here are the options. Option A. Wear gloves for the procedure. Option B. Place and adjust the pad from back to front. Option C. Cleanse and wipe the perineum from front to back. Option D. Protect the outer surface of the pad from contamination. The correct answer is option C. Cleanse and wipe the perineum from front to back. A perineal hygiene is a clean procedure and does not require the client to wear gloves. A care provider should wear gloves to adhere to universal precautions. B. The pad should be applied from front to back to prevent contamination of the birth canal or urinary tract from rectal bacteria. C. Wiping from front to back and discarding the wipe prevents contamination of the urinary tract and birth canal from rectal bacteria. D. The inner surface of the pad should not be touched to maintain asepsis. Question 53. In teaching the client about proper umbilical cord care, the nurse recommends that. Here are the options. Option A. Petrolatum be placed around the cord after the sponge bath. Option B. A belly binder be applied to prevent umbilical hernia. Option C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. Option D. The cord clamp be left on until the cord stump separates. The correct answer is option C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. A petrolatum does not allow the cord to dry and will encourage infection. B. Belly binders do not facilitate drying of the cord and will encourage abdominal relaxation. C. Frequent applications of alcohol will facilitate drying and discourage infection. D. The cord clamp can be removed in 24 hours. Leaving it on is cumbersome and could pull on the cord unnecessarily. Question 54. A baby is circumcised. Immediate postoperative care should include. Here are the options. Option A. Applying a loose diaper. Option B. Keeping the baby NPO for 4 hours to avoid vomiting. Option C. Changing the dressing frequently using dry, sterile gauze. Option D. Taking the baby to his mother for cuddling. The correct answer is option D. Taking the baby to his mother for cuddling. A pressure diaper should be applied to discourage hemorrhage. B. The baby can be fed by his mother soon after the procedure, once it is assessed that he is not in any distress and is stable. C. Dressing changes should not be dry. Dry dressing will stick. D. Cuddling after the procedure will hopefully quiet the baby. Feeding is also important if his feeding was withheld prior to the procedure or it is time for a feeding. Question 55. A 28-year-old multigravida has class Roman II heart disease. At her prenatal visit at 34 weeks gestation, all of the following observations are made, which would require intervention. Here are the options. Option A. Weight gain of 2 kg in 4 weeks. Option B. Blood pressure of 1/28/78. Option C. Subjective data. Shortness of breath after showering. Option D. Ankle edema reported present in late afternoon and evenings. The correct answer is option C. Subjective data. Shortness of breath after showering. This is not an excessive weight gain indicative of fluid retention. B. The blood pressure is within normal range. C. Showering should not cause shortness of breath. This could be a sign of cardiac decompensation. D. Dependent ankle edema is normal late in the day among pregnant women. Progressive edema would be a dangerous development. Question 56. A client is admitted to the labor room. She is dilated 4 cm. She is placed on electric fetal monitoring. Which of the following observations necessitates notifying the physician? Here are the options. Option A. Contractions every 2 minutes, lasting 100 seconds. Option B. Fetal heart decelerations during a contraction. Option C. Beat-to-beat variability between contractions. Option D. Fetal heart decelerations at the beginning of contractions. The correct answer is option A. Contractions every 2 minutes, lasting 100 seconds. These are tetanic in nature and can cause rupture of the uterus. B. The FHR decreases during contractions owing to vasoconstriction and should recover after the contraction. C. Beat-to-beat variability is a normal finding and demonstrates fetal well-being. D. The FHR may decrease at the beginning of a contraction owing to head compression. Question 57. A client has been in labor 10 hours and is becoming very tired. She has dilated to 7 cm and is at gestation with the fetus in a right occipit posterior position. She is complaining of severe backache with each contraction. One comfort measure the nurse can employ is to. Here are the options. Option A. Place her in knee chest position during the contraction. Option B. Use ephiurage during the contraction. Option C. Apply strong sacral pressure during the contraction. Option D. Have her push with each contraction. The correct answer is option C. Apply strong sacral pressure during the contraction. This measure is inappropriate. The knee-chest position is employed to take pressure off the cord. The effleurage is a comfort measure, but not the one that will contribute most to the relief of backache caused by a posterior position. C. Sacral pressure will counteract the pressure created by the position of the fetal head. D. The client is not completely dilated. Pushing is contraindicated until the second stage of labor. Question 58. The nurse in the mental health center is instructing a depressed client about the dietary restrictions necessary in taking her medication, which is a monoamine oxidase MAO inhibitor. Which of the following is she restricting from the client's diet? Here are the options. Option A, cream cheese. Option B, fresh fruits. Option C, aged cheese. Option D, yeast bread. The correct answer is option C, aged cheese. A cream cheese does not contain thiamine, which might cause a hypertensive crisis. B. Fresh fruits do not contain thiamine, which might cause a hypertensive crisis. C. Aged or matured cheese combined with a monoamine oxidase predisposes the client to a hypertensive crisis. D. Bread products raised with yeast do not contain thiamine. Question 59. A client suffering from schizophrenia has been taking chlorpromazine thorazine for 6 months. On one of his follow-up visits to the mental health center, the nurse reports to the physician that he has developed tardive dyskinesia. Which of the following symptoms might she have observed in the client to support this conclusion? Here are the options. Option A, high fever, tachycardia, stupor, renal failure. Option B, lip smacking, chewing, blinking, lateral jaw movements. Option C, photosensitivity, orthostatic hypotension, dry mouth. Option D, constipation, blurred vision, drowsiness. The correct answer is option B, lip smacking, chewing, blinking, lateral jaw movements. These symptoms are found in clients with neuroleptic malignant syndrome. B. These symptoms are found in clients with tardive dyskinesia. C. These are normal side effects found in clients taking antipsychotic medications. D. These are also normal side effects found in clients taking antipsychotic medications. Question 60. On morning rounds, the nurse found a manic depressive client who is taking lithium in a confused mental state, vomiting, twitching, and exhibiting a coarse hand tremor. Which one of the following nursing actions is essential at this time? Here are the options. Option A, administer her next dosage of lithium and then call the physician. Option B, withhold her lithium and report her symptoms to the physician. Option C, place her on NPO to decrease the excretion of lithium from her body and call the physician. Option D, contact the lab and request a lithium level in 30 minutes and call the physician. The correct answer is option B, withhold her lithium and report her symptoms to the physician. The client has lithium toxicity, and the nurse must withhold further dosages. B. Because of her level of toxicity, further lithium could cause coma and death. The nurse needs further orders from the physician to stabilize the client's lithium level. C. Ensuring adequate intake of sodium chloride will promote excretion of lithium and will assist in managing the client's lithium toxicity. D. A lithium blood level must be drawn immediately to determine the seriousness of the toxicity and to provide the physician with data for medical orders. Question 61. In acute episodes of mania, lithium is effective in 12 weeks, but it may take up to 4 weeks or even a few months to treat symptoms fully. Sometimes an antipsychotic agent is prescribed during the first few days or weeks of an acute episode to manage severe behavioral excitement and acute psychotic symptoms. In addition to the lithium, which one of the following medications might the physician prescribe? Here are the options. Option A, diazepam Valium. Option B, haloperidol. Option C, sertraline Zoloft. Option D, alprazolam Xanax. The correct answer is option B, haloperidol. A diazepam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. B. Haloperidol is an antipsychotic medication and may be used until the lithium takes effect. C. Sertraline is an antidepressant and is used primarily to reduce symptoms of depression. D. Alprazolam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. Question 62. The healthcare team determines that an elderly client has had progressive changes in memory over the last 2 years that have interfered with her personal, social, or occupational functioning. Her memory, learning, attention, and judgment have all been affected in some way. These symptoms describe which of the following conditions? Here are the options. Option A, dementia. Option B, Parkinsonism. Option C, delirium. Option D, mania. The correct answer is option A, dementia. These changes are common characteristics of dementia. B. Parkinson's disease affects the muscular system. Progressive memory changes are not presenting symptoms. C. Delirium includes an altered level of consciousness, which is not found in dementia. D. Mania includes symptoms of hyperactivity, flight of ideas, and illusions of grandeur. Question 63. A husband and wife and their 2 children, age 9 and age 5, are requesting family therapy. Which of the following strategies is most therapeutic for the nurse to use during the initial interaction with a family? Here are the options. Option A, always allow the most focal person to state the problem first. Option B, encourage the mother to speak for the children. Option C, interpret immediately what seems to be going on within the family. Option D, allow family members to assume the seats as they choose. The correct answer is option D. Allow family members to assume the seats as they choose. One will always hear what the most focal person has to say. It is best to start with the quietest family member to encourage that person to express emotions. B. All family members are encouraged to speak for themselves. C. In the initial family assessment, only data collection occurs. Interpretations are made later. D. Allowing family members to choose their own seats will assist the nurse in assessing the family system and in determining who feels closer to whom. Question 64. In healthcare settings, nurses must be familiar with primary, secondary, and tertiary levels of care. As a nurse in the community, which of the following interventions might be a primary prevention strategy? Here are the options. Option A, crisis intervention with an intoxicated teenager whose mother just committed suicide. Option B, referring a client who has been on a detoxification unit to a rehabilitation center. Option C, teaching 5th grade children the harmful effects of substance abuse. Option D, counseling a client with post-traumatic stress disorder. The correct answer is option C, teaching 5th grade children the harmful effects of substance abuse. The teenager is already coping ineffectively and requires early detection and treatment, which is secondary prevention. B. The client must be sent to a rehabilitation unit, which requires tertiary prevention. C. Reducing the incidence of disease through education supports primary prevention. D. A client with identified symptoms of post-traumatic stress disorder requires intervention by treatment. Question 65. While the nurse is taking a male client's blood pressure, he makes flirtatious remarks to her. The nurse will handle this effectively if she. Here are the options. Option A. Politely tells the client, "Keep your hands off." Option B. Ignores the remarks and hopes you will not try it again. Option C. Confronts the remarks but attempts not to reject the client. Option D. Leaves the room in order to compose herself. The correct answer is option C. Confronts the remarks but attempts not to reject the client. This response does not recognize normal feelings of attraction and rejects the client. B. By ignoring the situation, the nurse has not set limits to discourage other remarks or perhaps more sexually aggressive behavior. C. By confronting the remarks, she can recognize that his feelings of attraction may be normal but are not appropriate within the context of their nurse-client relationship. D. Leaving the room does not deal with setting limits for future interactions. Question 66. A client is a victim of domestic violence. She is now receiving assistance at a shelter for battered women. She tells the nurse about the cycle of violence that she has been experiencing in her relationship with her husband of 5 years. In the tension-building phase, the nurse might expect the client to describe which of the following. Here are the options. Option A. Promises of gifts that her husband made to her. Option B. Acute battering of the client, characterized by his volatile discharge of tension. Option C. Minor battering incidents such as the throwing of food or dishes at her. Option D. A period of tenderness between the couple. The correct answer is option C. Minor battering incidents such as the throwing of food or dishes at her. This description is characteristic of the honeymoon or respite phase. B. This description is characteristic of the battering phase. C. This description is characteristic of the tension-building phase prior to the volatile discharge of tension found in the battering phase. D. This description is characteristic of the honeymoon or respite phase. Question 67. Which of the following symptoms might the nurse observe in a client with a lithium blood level over 2.0? Here are the options. Option A. Fine hand tremor, headache, mental dullness. Option B. Vomiting, impaired consciousness, decreased blood pressure. Option C. Polyuria, polydipsia, edema. Option D. Gastric irritation, nausea, diarrhea. The correct answer is option B. Vomiting, impaired consciousness, decreased blood pressure. These symptoms are acute, common, and usually harmless central nervous system side effects of lithium. B. These symptoms of lithium toxicity are usually dose-related. C. These symptoms are acute, common, and usually harmless renal side effects of lithium. D. These symptoms are acute, common, and usually harmless gastrointestinal side effects of lithium. Question 68. A psychiatric nurse is providing an orientation to a new staff nurse. She reminds the nurse that psychiatrists often use categories of medications and that it is important that she recall that some categories of medications have synonyms. Another name used to describe minor tranquilizers is which of the following? Here are the options. Option A. Antipsychotic medications. Option B. Antidepressant medications. Option C. Anti-anxiety medications. Option D. Antimania medication. The correct answer is option C. Anti-anxiety medications. Antipsychotic medications are also known as major tranquilizers. B antidepressants fall into different categories, such as the tricyclics or the MAO inhibitors. C anti-anxiety medications are also known as minor tranquilizers. D anti-mania medications are those such as lithium and lithium carbonate lithibid. Question 69. The nurse has been caring for a 16-year-old female who recently experienced date rape. After having had crisis intervention and been hospitalized for 2 weeks, the nurse knows that the client is effectively coping with the rape when she tells the nurse, here are the options. Option A. I know it was my fault that it happened, because I shouldn't have been out so late. Option B. If I had not worn that sexy dress that night, he wouldn't have raped me. Option C. I know my date just had so much passion he couldn't handle me saying no. Option D. I know now that it was not my fault, but I want to continue counseling after my discharge. The correct answer is option D. I know now that it was not my fault, but I want to continue counseling after my discharge. This response does not show any insight. The client falsely assumes that she is responsible for the rape. B. The client continues to falsely assume responsibility for the rapist's behavior. C. The client believes falsely that rape is an act of passion rather than one of violence, control, and domination. D. The client has insight into the rape. She does not believe it was her fault and shows good judgment in deciding to continue with counseling after discharge. Question 70. A 42-year-old male client has been treated at an alcoholic rehabilitation center for physiological alcohol dependence. The nurse will be able to determine that he is preparing for discharge and is effectively coping with his problem when he shares with her the following information. Here are the options. Option A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. Option B. I know that I can only drink 1 or 2 drinks at social gatherings in the future, but at least I don't have to continue AA. Option C. I really wasn't addicted to alcohol when I came here, I just needed some help dealing with my divorce. Option D. It really wasn't my fault that I had to come here. If my wife hadn't left, I wouldn't have needed those drinks. The correct answer is option A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. The client has insight into the severity of his alcohol addiction and has chosen one of the most effective treatment strategies to support him, Alcoholics Anonymous. B. The client is still using denial and is not dealing with his alcohol addiction. C. The client is exhibiting denial about his alcohol addiction and projecting blame on his divorce. D. The client is projecting blame onto his wife for being in the hospital while still denying his alcohol addiction. Question 71. Degenerative disorders are attributed to many factors. As a nurse assigned to a convalescent home, one must often educate families about how such conditions occur. Which of the following statements might the nurse need to explore when a daughter tries to explain to her mother what caused her degenerative disorder? Here are the options. Option A. Some folks believe that aging causes this, mother. Option B. Perhaps it's the way your parents used those double-bind messages, mother. Option C. I know some people who are having this problem and they were exposed to chemicals at work, mother. Option D. It can be caused by lots of things, toxic agents and even alcohol, mother. The correct answer is option B. Perhaps it's the way your parents used those double-bind messages, mother. Aging is a factor in the cause of degenerative disorders. B. Double-bind messages may be found in the histories of families of individuals who develop schizophrenia, but they are not related to degenerative disorders. C. Chemicals, toxic agents in work environments are predisposing factors to degenerative disorders. D. Alcohol causes some degenerative disorders such as Wernicke's syndrome. Question 72. A family is experiencing changes in their lifestyle in many ways. The invalid grandmother has moved in with them. The couple have a 2-year-old son by their marriage, and the wife has 2 children by her previous marriage. The older children are in high school. In applying systems theory to this family, it is important for the nurse to remember which of the following principles? Here are the options. Option A. The parts of a system are only minimally related. Option B. Dysfunction in one part affects every other part. Option C. A family system has no boundaries. Option D. Healthy families are enmeshed. The correct answer is option B. Dysfunction in one part affects every other part. The parts of a system are interrelated. B. Any change in any part of the system affects all other parts. C. A family system, like any other system, has boundaries. D. Healthy families are neither enmeshed nor disengaged. Question 73. The nurse is trying to help a mother understand what is happening with her son who has recently been diagnosed with paranoid schizophrenia. At present, he is experiencing hallucinations and delusions of persecution and suffers from poor hygiene. The nurse can best help her understand her son's condition by which of the following statements? Here are the options. Option A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. Option B. Has anyone in your family ever had schizophrenia? Option C. If your son has a twin, he probably will eventually develop schizophrenia too. Option D. Some of his symptoms may be a result of his lack of a strong mother-child bonding relationship. The correct answer is option A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. The most plausible theory to date is that dopamine causes an overstimulation in the brain, which results in the psychotic symptoms. This statement will only create anxiety in the mother, and the genetic theory is only one of the etiological factors. This statement will cause the mother much alarm, and nothing was mentioned about any other child. D. The mother-child relationship is one of the previous theories examined, but it is not one to be emphasized, thereby causing a lot of anxiety for the mother. Question 74. A male client is experiencing auditory hallucinations. His nurse enters the room and he tells her that his mother is talking to him, and he will take his medicine after she leaves. The nurse looks around the room and sees that she and the client are the only ones in the room. The nurse's most therapeutic response will be, here are the options. Option A. I don't see your mother in the room. Let's talk about how you're feeling. Option B. Okay, I'll come back later when you're feeling more like taking your medicine. Option C. She may be here, but I can't see her. Option D. Why don't you finish talking to her, and I'll wait. The correct answer is option A. I don't see your mother in the room. Let's talk about how you're feeling. This response uses the principle of reality orientation by the nurse telling the client that he or she does not see anything, but it does recognize his feelings. B. This response does not make it clear that the nurse does not see anyone else in the room, and the nurse leaves the client alone to continue hallucinating. C. This response leaves room for doubt. The nurse is further confusing the client by this statement. D. This response reinforces the hallucination and implies that the nurse sees his mother too. Question 75. A female client with major depression stated that life is hopeless and not worth living. The nurse should place highest priority on which of the following questions? Here are the options. Option A. How has your appetite been recently? Option B. Have you thought about hurting yourself? Option C. How is your relationship with your husband? Option D. How has your depression affected your daily living activities? The correct answer is option B. Have you thought about hurting yourself? Although eating habits are important to assess, they are less important than suicidal intent. B. Maintenance of the client's life is the priority. Assessment of suicidal intent is imperative. C. Relationships and support systems are an important part of assessment, but they are less important than suicidal intent. D. Daily living activities will give additional information about the level of depression and are less significant than suicidal intent, although this information may give additional information about the actual plan for a suicidal attempt. Question 76. A client presented herself to the mental health center, describing the following symptoms: a weight loss of 20 lb in the past 2 months, difficulty concentrating, repeated absences from work due to fatigue, and not wanting to get dressed in the morning. She leaves her recorded message on her telephone and has lost interest in answering the phone or doorbell. The nurse's assessment of her behavior would most likely be: here are the options. Option A. Deep depression. Option B. Psychotic depression. Option C. Severe anxiety. Option D. Severe depression. The correct answer is option D. Severe depression. A client in deep depression would have been brought to the mental health center and would not be physically able to seek help for herself. B. She is not manifesting psychotic symptoms in her behaviors. C. The client's symptoms are more indicative of depression than anxiety. D. Although the client was able to bring herself to the mental health center, the extent of her weight loss and the interference of symptoms with activities of daily living indicate that she is severely depressed. Question 77. A 48-year-old male client is hospitalized with mild ascites, bruising, and jaundice. He has a 20-year history of alcohol abuse. The client is diagnosed with cirrhosis. His serum ammonia level is high, indicating hepatic encephalopathy. He has esophageal varices. Which of the following may cause the varices to rupture? Here are the options. Option A. Lifting heavy objects. Option B. Walking briskly. Option C. Ingestion of barbiturates. Option D. Ingestion of antacids. The correct answer is option A. Lifting heavy objects. Lifting heavy objects will increase intrathoracic pressure, thus placing the client at risk for rupturing esophageal varices. B, C, D. This activity will not cause an increase in intrathoracic pressure. Question 78. Due to his prolonged history of alcohol abuse, an alcoholic client will most likely have deficiencies of which of the following nutrients? Here are the options. Option A. Vitamin C and zinc. Option B. Folic acid and niacin. Option C. Vitamin A and biotin. Option D. Thiamine and pyrazidine. The correct answer is option D. Thiamine and pyrazidine. A chronic alcoholism can lead to deficiencies of B-complex vitamins including thiamine and pyrazidine. B. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B complex. C. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B complex. D. Vitamins A, D, K, and B require bile salts to be absorbed from the gastrointestinal tract. A damaged liver does not form bile salts. Question 79. The physician of an alcoholic client places him on a low-protein, high-carbohydrate diet. When choosing his menu, the client's best choice from the items below would be, here are the options. Option A. Liver and onions, macaroni and cheese tea with sugar. Option B. Baked chicken, baked potato with bacon bits, milk. Option C. Waffles with butter and honey, orange juice. Option D. Cheese omelet with ham and mushrooms, milk. The correct answer is option C. Waffles with butter and honey, orange juice. A, B, D. These foods are high in protein, which needs to be restricted. C. Serum ammonia levels can be decreased by restricting dietary protein intake. Waffles, honey, and orange juice are high in carbohydrate and low or completely lacking in protein. Butter, a concentrated fat, will provide extra calories. Question 80. A chronic alcoholic client's condition deteriorates, and he begins to exhibit signs of hepatic coma. Which of the following is an early sign of impending hepatic coma? Here are the options. Option A. Hiccups. Option B. Anorexia. Option C. Mental confusion. Option D. Fetor hepaticus. The correct answer is option C. Mental confusion. Hiccups are not a sign of impending hepatic coma. B. Anorexia is not a sign of impending hepatic coma. C. One of the earliest symptoms of hepatic coma is mental confusion. Asterixis, a flapping tremor of the hand, may also be seen. D. This sign is associated with the later stages of hepatic coma. Fetor hepaticus, a characteristic odor on the breath that smells like acetone, may sometimes be noted when the liver fails. Question 81. The physician of a client diagnosed with alcoholism orders neomycin 0.5 GQ6H to prevent hepatic coma. Neomycin decreases serum ammonia levels by. Here are the options. Option A. Decreasing nitrogen-forming bacteria in the intestines. Option B. Acidifying colon contents by causing ammonia retention in the colon. Option C. Decreasing the uptake of vitamin D, thereby drawing more water into the colon. Option D. Irritating the bowel and promoting evacuation of stool. The correct answer is option A. Decreasing nitrogen-forming bacteria in the intestines. A neomycin interferes with protein synthesis in the bacterial cell, causing bacterial death. Neomycin reduces the growth of the ammonia-producing bacteria in the intestines and is used for the treatment of hepatic coma. B. This choice describes the action of lactulose, another drug commonly used to decrease systemic ammonia levels. C. Neomycin's action does not decrease uptake of vitamin D to reduce serum ammonia levels. D. Bowel irritation with diarrhea is more likely to occur with administration of lactulose rather than of neomycin. Besides, diarrhea is a side effect of a drug, not the action of the drug. Question 82. A 26-year-old male client is brought by his wife to the emergency department ED unconscious. Blood is drawn for a stat blood count CBC, fasting blood sugar level, and electrolytes. An indwelling urinary catheter is inserted. He has a history of type 1 diabetes, insulin-dependent diabetes mellitus item. A diagnosis of ketoacidosis is made. Stat lab values reveal a blood sugar level of 520 mg/dl. Which of the following should the nurse expect to administer in the ER? Here are the options. Option A. D50W by Roman 4 push. Option B. NPH insulin SC. Option C. Regular insulin by Roman 4 infusion. Option D. Sweetened grape juice by mouth. The correct answer is option C. Regular insulin by Roman 4 infusion. This action would further increase the client's blood sugar. BNPH insulin is an intermediate-acting insulin, with an average of 46 hours before onset of action. The client needs insulin that will act immediately. During a ketoacidotic state, the client is dehydrated, so any insulin administered as SC will be poorly absorbed. C. Regular insulin is the fastest-acting insulin. When given Roman 4, it will immediately act to decrease blood sugar. Regular insulin is given to decrease blood glucose levels by promoting metabolism of glucose, inhibiting lipolysis and formation of ketone bodies. D. This action would further increase the client's blood sugar. Question 83. A client with item is given Roman 4 insulin for a blood glucose level of 520 mg/dl. Life-threatening complications may occur initially, so the nurse will monitor him closely for serum. Here are the options. Option A. Fluoride level of 99 mg/L. Option B. Sodium level of 136 mg/L. Option C. Potassium level of 3.1 mg/L. Option D. Potassium level of 6.3 mg/L. The correct answer is option D. Potassium level of 6.3 mg/L. The chloride level is within acceptable limits. B. The sodium level is within acceptable limits. C. This value indicates hypokalemia, rather than the hyperkalemia that occurs during diabetic ketoacidosis. D. When diabetic ketoacidosis exists, intracellular dehydration occurs and potassium leaves the cells and enters the vascular system, thus increasing the serum level beyond an acceptable range. When insulin and fluids are administered, cell walls are repaired and potassium is transported back into the cells. Normal serum potassium levels range from 3.5–5.0 mg/L. Question 84. An item client's condition stabilizes. He begins to receive a daily injection of NPH insulin at 6:30 a.m. The nurse can most likely expect a hypoglycemic reaction to occur that same day at, here are the options. Option A. 8:30 a.m. 10:30 a.m. Option B. 2:30 p.m. 4:30 p.m. Option C. 7:30 p.m. 9:30 p.m. Option D. 10:30 p.m. 11:30 p.m. The correct answer is option B. 2:30 p.m. 4:30 p.m. This time describes the time of onset of NPH insulin's action rather than its peak effect. BNPH insulin, an intermediate-acting insulin, usually begins to lower serum glucose levels about 2 hours after administration. The action of NPH insulin peaks 18 to 14 hours after administration. It has a 2,030-hour duration. C. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. D. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. Question 85. After several days, an item client's serum glucose stabilizes, and the registered nurse continues client teaching in preparation for his discharge. The nurse helps him plan an American Diabetes Association diet and explains how foods can be substituted on the exchange list. He can substitute 1 oz of poultry for. Here are the options. Option A, 1 frankfurter. Option B, 1 ounce of ham. Option C, 2 slices of bacon. Option D, 1/4 cup dry cottage cheese. The correct answer is option D, 1/4 cup dry cottage cheese. A frankfurter is a high-fat meat on the diabetic exchange list. B ham is a medium-fat meat on the diabetic exchange list unless it is a center-cut slice. C 1 strip of bacon equals 1 Fa exchange rather than AMA exchange. Dietary substitution should occur within exchange lists and not between exchange lists. D diabetic meat exchange lists are categorized into lean meat foods, medium-fat meats, and high-fat meats. Cottage cheese dry, 2% butterfat, 1/4 cup, can substitute for 1 lean meat exchange. Question 86. When discussing the relationship between exercise and insulin requirements, a 26-year-old client with item should be instructed that. Here are the options. Option A. When exercise is increased, insulin needs are increased. Option B. When exercise is increased, insulin needs are decreased. Option C. When exercise is increased, there is no change in insulin needs. Option D. When exercise is decreased, insulin needs are decreased. The correct answer is option B. When exercise is increased, insulin needs are decreased. But if the client's insulin is increased when activity level is increased, hypoglycemia may result. B. Exercise decrease the blood sugar by promoting uptake of glucose by the muscles. Consequently, less insulin is needed to metabolize ingested carbohydrates. Extra food may be required for extra activity. See, this statement directly contradicts the correct answer and is inaccurate. D. When exercise is decreased, the client's insulin dose does not need to be altered unless the blood sugar becomes unstable.